The good thing about hair removal with lasers is that it's long term. It's not like waxing or shaving. You're actually removing the hair in its root so it doesn't come back.
Perfect. Can you take a seat for me?
Thank you.
So we get all of our patients to have consultations before they start treatments, just so that we can assess their problem and make sure that it's the right treatment that they're going for, and we can then explain the full treatment in detail so they're fully aware of what they're doing. Follow me, we'll go through to the consultation room. Okay. Just this room over here. Right, Sharon, so I've got you in today for a consultation about laser hair removal, is that right?
Yeah, that's right.
Perfect. Okay, so I've got you in for 40 minutes today. So what we're going to do, we're going to talk through the whole process of laser hair removal and how it works, how many treatments you'll need. I'll go through the pre-care and the aftercare of the treatments, have a little assessment of the area and just hope that it's suitable. Then we'll go through prices at the end and do a test patch if you're happy with everything. We always do a test patch just to make sure we know what the skin's reaction is going to be. And then we can get them started that week. So we have to leave 4 days from the test patch and then any time after that. So I've got you in today to do the half face area and also the underarm area, is that right? Perfect, okay. And the last time you had these treated? And so they need to make sure that they come with the area clean for the appointment, so no fake tan or makeup or moisturiser on the skin, and also that they have shaved the area prior to treatment. It does scare some patients, they worried that it does cause thicker hair growth, but that is a myth. It doesn't make the hair growth any thicker, it just takes off the surface. We'll start with the face area. Okay.
The way the hair is prepared for laser treatment is that we like the hair to be in the roots, that's under the skin, but not a lot of hair on the skin surface. So the hair is usually shaved or trimmed very close to the skin surface. So what we don't want is the hair on the skin getting hot, we want the roots. So the first thing is basically make sure the skin's clean, there's no makeup or perfume on the skin, and that the hair's been shaved.
Perfectly clean. Just get some aloe vera gel to put on your skin, okay? Just tuck your head behind your ears just to make sure it's out of the way. It's a bit cold.
Laser hair removal involves using shots of laser beams. These are little high-powered beams of light, and they go into the skin and then they react with the hair follicle, which is the root of the hair, and they heat it up for a very short period of time. If we can heat the hair up enough, then it will stop it growing and that hair won't regrow. There are other certain safety precautions. For example, when we use lasers, everybody in the room has to wear eye protection, and so we make sure that that's all done before we start.
Yeah, comfortable?
Yeah,
lovely.
totally.
Okay. Okay, so I'm turning the laser on now, so you're just going to hear it beep. There we go, so it's ready to go. I'm going to turn on the air cooler. It makes quite a loud noise, okay, so don't worry about that. Can you turn your head slightly to the left? I'm going to hold your hair out the way. We're going to start over here and work in lines along the cheek. If you need me to stop at any point, just let me know and I will do. If you try to stay as still as possible for me. Okay? You ready?
Yeah.
Yeah. Okay, here we go, Sharon. Okay, how does that feel?
That's fine.
All right with
Yeah.
that?
The laser is lined up over the area and treated. We don't use the laser to treat individual hairs because the laser beam is quite big, about the size of a 5p piece. So it's used to treat the area where hairs are, not individual hairs.
There we go, Sharon. That's all done for you. Just bear with me a second while I just turn the laser off and dismantle it. Okay.
Well, there's a sensation of heat after laser treatment. It can be uncomfortable, very, very rarely painful, but it can be uncomfortable. And so after treatment, the skin can be cooled down. We usually use aloe vera gel in our clinics here at Skin, but also we can blow cold air on the skin, or you can use ice packs. This isn't usually necessary. And so that feeling of heat will gradually fade away, and then the skin can remain a little bit tender and a little bit red for a day or two maybe, then it usually settles down quite quickly.
Lovely. Okay, if you lean forward, we'll get those goggles off. Okay, you feeling alright?
Yeah, that's fine.
Not too sore at all?
No, not all. A little warm, but that's all.
That's good. Right, so I'm going to pop another layer of aloe vera gel on, just to help cool the skin down a bit more. You rest your head back. And then before you go, we'll pop on some sunblock just to protect you.
You can normally see the results after a few weeks of the first treatment, but what's really happening is you're getting an additive effect from each visit. So after you've had 3 or 4 treatments, you start to see a real reduction in the amount of hair that you have.
Okay, Sharon, so let's book your next one in. So it's due another 4 weeks' time.
It works best on growing hair, and on any particular day not all the hair in the area is actively growing. So that usually means people have to have a course of treatment, usually every 4 to 8 weeks. And in general you need about 6 to 8 treatments to get all those growing hairs out.
Okay, so in here, Sharon, I've got you an aloe vera gel.
Yeah.
So that's just to keep applying over to the area today to keep it cool.
It's really important that you have medically trained professionals in the clinic where you have laser hair removal. Lasers actually have the potential to cause quite considerable damage to the skin, and with nurses and doctors in place they will help assess suitable clients for treatment, ensuring that protocols are followed too. So all our practitioners follow extremely robust protocols, and nurses and doctors ensure that process is followed.
There you go. Lovely, right. I'll see you in 4 weeks' time. Any problems, give me a call.
Okay, thanks.
It's becoming increasingly popular. We're seeing all walks of people coming through the doors, all ethnicities, all age ranges. Very, very popular at the moment.
The commonest areas are probably facial hair, armpits and bikini line hair. In patients with darker skin, the commonest area we treat is on the face. What we generally don't do are areas like the scalp, for example, because people might change their mind about that, and we don't tend to do eyebrows, but virtually any other hair on the body can be treated.